Psychological facts about boobs and mental health every woman should know. Women who have their boobs done are 4 times more likely to commit suicide than the general public rate. Breast augmentation surgery is one of the most common cosmetic procedures among women. It is estimated that approximately 300,000 women undergo breast augmentation surgery annually in the United States alone. It is considered normal for women to have cosmetic surgery in order to become or remain attractive to the opposite sex. Women no longer view their breasts as body parts to feed babies, but as body parts to be enjoyed by men. Women interested in breast augmentation say they do it because they are dissatisfied with their bodies, they lack self-confidence, they feel embarrassed all the time, and they are insecure. Some say because of the desire to feel more feminine and more attractive to men. Most studies agree that the typical woman that wants to get her boobs done is more often Caucasian, between 28 to 44 years of age. Thin and tall, a smoker, consuming alcohol, with good educational background, and likely to have a history of depression, anxiety, and neurotic personality. They seek psychiatric consultations more often than the general population does and have an increased rate of psychiatric hospital admissions prior to the cosmetic surgery. Regarding their reproductive history, they have a younger age at menopause, a greater number of full pregnancies, and are more likely to have had an induced abortion. Studies remain inconclusive regarding their marital status. Women with small breasts who feel embarrassed by the size of their breasts tend to avoid having sex because the thought of undressing in front of their lover is more painful and humiliating. Big-breasted women get a hitchhiking ride more easily when the driver is a man. They are solicited more frequently in nightclubs and bars. More often than not, big-breasted waitresses receive higher tips compared to women with small breasts. Most women, after getting a boob job, undergo some personality changes, for example, how they walk, stand, and talk changes. They become more confident and more satisfied with their own body image. Women with large breasts are perceived by men to be more open to casual sex than women with small breasts, which encourages men to initiate short-term sexual relationships with large breast women. Women and men perceive breasts in a similar way to each other. The bigger the breasts, the higher the reproductive efficiency, lactational efficiency, sexual desire, and promiscuity attributed to the woman. In addition, big-breasted women were perceived as less faithful and less intelligent than women with average or small breasts. Knowing someone who had their boobs done is a 60% boost for most women who want to get their boobs done. Women who are frequently teased for their breast size express a lot of interest in getting their boobs done. Most studies have found that the most frequent motivation for breast augmentation is related to a desire to feel more attractive, more feminine, and more confident. Research has also shown that women with breast augmentation have a higher divorce rate. Eating disorders are common among women who are dissatisfied with the size and shape of their breasts. Breasts are often considered an important symbol of femininity. Not having them can create a sense of insecurity in women and decrease their self-esteem, as seen in the study. These studies in 2015 established that women with large breasts are perceived as being older, sexually more mature, possessing better reproductive health and nurturing ability, but lower in intelligence and morality. Research found that the stereotypical candidate for a boobs job comes from a specific social level and is often not well educated. She is influenced by Photoshop pictures of models on the front pages of tabloids and popular magazines that celebrate voluptuous women and physical appearance. Breast size is not important in nursing. Women with small breasts nurse just as well as women with large breasts. Heavy media influence on women's breasts have caused women to view their breast as sexual objects built for men's pleasure and not for childbearing. Several studies have found that breast augmentation has a positive impact on women in terms of improving self-esteem and depressive symptoms, enhancing body image, and increasing well-being. Intimate reasons for getting a boobs job are mostly related to the feeling a woman has for their partner, their willingness to show their naked breasts to their partners, and the overall improvement the surgery would have on their sexual life. Several studies have reported that women who undergo breast augmentation surgery are more likely to use tobacco and alcohol, have higher anxiety levels, and more likely to have an erotic personality. In America today, the sexual significance of the female breast rivals if not exceeds its biological significance. In our culture today, breasts are to be looked at and enjoyed by grown men, not babies. Many women choose to stop breastfeeding or avoid it altogether because they are uncomfortable nursing in the presence of others. They and their male partners also worry that breastfeeding will make their breasts ugly. An expert review found that for every 12 months of breastfeeding, there was a 4.3% reduction in the relative risk for breast cancer, with an additional 7% decrease in breast cancer for each child that was breastfed. Experts suggest breastfeeding can reduce breast cancer incidence up to 11%. Longitudinal studies that investigated the effects of breast augmentation on the psychological status of women found that the surgery improved their psychosocial and sexual well-being, increased their satisfaction level with their breasts, and enhanced their body image, which consequently boosted their self-esteem, decreased depressive symptomatology, and alleviated their eating disorders. Breast reduction and breast lift surgeries are common among women over the age of 40. Depending on the type of surgery performed after a breast reduction or breast lift surgery, most women can no longer breastfeed again. In most countries, cosmetic breast surgeries are not covered by health insurance policies because they are considered cosmetic. The health risks and dangers of failed breast surgeries are often downplayed in research findings, mainly because it will be bad PR for the companies and research institutes funding most of the research projects. While it is important and okay to enhance one's physical traits, women going for any type of cosmetic surgery should seek counseling in order to be ready to deal with post-surgery results and complications. Did you know that the most common use criteria to identify gender in adults are breasts? Did you know that women's breasts caressed before sex and claps during sex, the orgasm quicker? Did you learn anything? If you did, leave a comment in the comments section to inspire someone.